Thank you for joining us for the first session of our 2020-2021 Patient and Public Engagement Lunchtime Learning Series. Today's topic is Introduction to Patient Engagement, followed by the launch of our 2020 Prep Awards for pre-grant patient engagement in Manitoba. Our patient engagement lead at CHI, Carolyn Shimmin, will take you through the intro to patient engagement piece, and then I'll share some info about the Prep Award and features of a strong application. And even though the award is only for projects within Manitoba, the information provided will be valuable for anyone, including patient engagement and funding applications to other agencies. This webinar will be recorded for future viewing, available on our YouTube channel. And I'll turn it over to you, Carolyn.
Thanks so much, Trish, for the introduction. I'd first like to start off by acknowledging that all the presenters today from the George and Fahey Center for Healthcare Innovation are gathered on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, and Dakota and Dene peoples, and homeland of the Métis Nation. And in coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems, and we dedicate ourselves to moving forward in partnership in a spirit of reconciliation, collaboration, and social justice. In talking about patient and public engagement in health research, it's really important to know that Indigenous research methodologies are at the forefront. And Indigenous scholars, researchers, and communities are people we should be looking to. So what are we going to be talking about today? Here's a bit of an outline of today's talk. First, we're going to explore what is patient-oriented research, and then how do we define patient engagement? Then we're going to look a little bit at what a patient engagement is not, because sometimes we get a better understanding of what something is by looking at what it isn't. Then we're going to delve into some of the guiding principles and core beliefs that underlie patient engagement in health research, and taking a look at some of the reasons why we should engage. And finally, we'll briefly touch upon levels of engagement, and then our wonderful Trish we'll take over and discuss the Center for Healthcare Innovation's Prep Award. And again, I'd like to emphasize, I would stick around as well, because a lot of the information that Trish is going to give to you is relevant to other funding opportunities as well. Because this webinar series is accredited by the Royal College of Physicians and Surgeons of Canada, we would like to disclose that both Trish and I are employed by the George and Fahey Center for Healthcare Innovation. So what is patient-oriented research? We hear the term a lot, but how is it different from other types of health research? What makes it unique? Well, the Strategy for Patient-Oriented Research, which is a national initiative funded by the Canadian Institutes of Health Research, in which CHI, or the Center for Healthcare Innovation, is actually the Manitoba support unit. There's a support unit in every province and territory. But we're going to look at SPOR to find out what the definition is. And they define patient-oriented research as a continuum of research that involves 5 key components. First, it engages patients as partners in research decision-making. Second, it focuses on patient-identified priorities. Third, it improves patient outcomes. Fourth, it's conducted by multidisciplinary teams in partnership with relevant stakeholders and rights holders. So this could be not only patient partners, but also healthcare decision makers, policy makers, healthcare professionals within the system. And then 5, it aims to apply the knowledge generated to improve healthcare systems and practice. And note the capitalized, underlined, and bolded "and," because I really wanted to emphasize that patient-oriented research is supposed to encapsulate all of these components, not just 1 or 2. Now, what is patient engagement in health research? Again, we're going to look at the Canada Strategy for Patient-Oriented Research to look at how they define it first. So, SPORE says that patient engagement in health research is the meaningful and active involvement of patients in the governance of research. So this could be patient partners on research teams, steering committees, operations committees, sometimes even data safety monitoring boards. Also patients engaged in the priority setting of research. So the research has to be a priority defined by patient partners who are living with the health condition, caregivers, communities. The conducting of research. So sometimes we have patient partners actually as co-researchers who are conducting interviews or co-facilitating focus groups and qualitative research. And then the knowledge translation of research. So involving patient partners in the co-development of ways in which the research findings can be shared and implemented. And another great way of thinking about it, this is a definition from Involve, which has been around in the UK since about 1997. And it's research that is carried out with or by members of the public rather than to, about, or for them. And at the Center for Healthcare Innovation, we like to define engagement as people, informal caregivers, families, and communities with lived experience of a health condition or health conditions, having a say in decision-making about the research process. So whether it's identifying the priority area, clarifying and defining the research question, helping co-develop the methods or design, doing data collection or interpreting the findings or sharing the findings. But the key thing to remember is that it's about partnering and collaborating with people with lived experiential knowledge of a health condition in actual research decision-making. Now, sometimes we have to look at what patient engagement is not, because there can be a little bit of confusion sometimes. So here's some examples of what patient engagement would not be. So people being recruited to a clinical trial or other research study to take part in the research. So people who are actually participants in a study, you're collecting data, because these people wouldn't be informing research decisions. And that's what we're really thinking about when we're saying partnering. People completing a questionnaire or participating in a focus group as part of the research, again, they're study participants. This wouldn't be considered patient engagement. Science festivals open to the public with debates and discussion about research. Again, awesome. It's great to share research findings and have conversations about it, but it wouldn't necessarily be considered engagement because people aren't actively sharing in the decision-making around research processes. Open houses at a research center where members of the public are invited to find out about research. Awesome. Again, CHI does that a lot, but wouldn't be considered patient engagement in health research decision-making. Raising awareness of research through media, such as television programs, newspapers, and social media. I'm a huge proponent of this, and I love when researchers speak about their findings and share their findings through mainstream media. But again, it wouldn't be considered engagement because there's no active two-way dialogue going on around a decision. Sharing research findings with participants, colleagues and members of the public, this should always be done. A little bit of a reminder, we should always be sharing our research findings back with participants and colleagues and members of the public. But again, this wouldn't be considered patient engagement in health research. So what are some of the guiding principles and core beliefs that underlie patient engagement in health research? And so the guiding principles that were originally laid out by SPORE around the patient engagement framework include inclusiveness. So making sure to integrate diverse patient and public perspectives and research that actually reflects those diverse contributions. Support is another big one we hear a lot about, and that's supporting partners in being able to fully contribute to the research process. And that's creating safe environments, We're huge proponents of anti-oppressive practice and trauma-informed approaches, making sure that researchers and partners have appropriate training and capacity building and education, and compensation is a huge one. Compensating people with lived experience for all that they bring to the table, their experiential knowledge and insight and contributions. And in our November series, our November session of this series, we'll be actually talking about how to budget for inclusive engagement. So I would definitely check that one out, because we'll get more into different methods of compensating people with lived experience. Mutual respect and partnership, again, is another one. The value of experiential knowledge is being recognized by everyone on the research team. Co-building. So people with lived experience, researchers, communities, practitioners are working together from the beginning to identify problems and gaps, set priorities for research, and collaboratively produce and implement solutions. Co-learning. There's a lot to be learned from both sides, right? Patient and public partners learning about the research process, but also researchers learning about patient-centered engagement and the importance of and how to build relationships with communities. Reciprocal relationships. This is where we start talking about shared power and decision-making. And it's really important to think about in which ways you're going to come to a consensus, what approaches you might want to use, and then transparency, honesty, and trust. So that's really about open communication, reflexive practice, and conflict resolution. And some of the core beliefs that underlie patient engagement and health research is the idea that it will lead to improved health outcomes and an enhanced healthcare system that's going to increase the quality, the appropriateness, the acceptability, the transparency, and the relevance of research. And then it's also going to ensure that health research actually addresses issues of importance to people with lived experience of the health condition in which you're researching. So the one thing that we really need to think about when we think of patient and public engagement is sometimes it can be not only the terminology patient, but actually the conceptualization can exclude certain people. So we have to think about people who may not identify as patient because they are unable to access the healthcare system because of geographical barriers, so thinking about the differences between urban, rural, and remote, but also systemic barriers, thinking about people who confront systemic racism, colonialism, sexism, homophobia, transphobia, ableism, saneism, classism, all of these different things when they try to access healthcare services. And then thinking about people who may be living with mental health or substance use issues, where taking up the label of patient is actually associated with a lot of stigma, and having that understanding. There's also people who may refuse to engage or prematurely exit the healthcare system because of unresponsive or disrespectful care. So we need to start having thoughts around how are we going to engage these voices and perspectives as well. And then also people living with a disability where just being differently abled may be continuously medicalized by the healthcare system, and hence terms like patient are just not relevant or are associated with a lot of pain and judgment. And so we really want to make sure that we're cognizant of these issues that are underlying, and we're making sure that we're addressing them and figuring out ways to engage all of these different perspectives that may face multiple barriers within healthcare systems. And one of the things that we're going to discuss in our October session is our belief at the Center for Healthcare Innovation that patient engagement and health research must be grounded in social justice and health equity. And we advocate for the incorporation of a trauma-informed and intersectional analysis in engagement approaches, and the valuing all voices framework is one that complements and expands upon where the SPORE patient engagement framework it expands on there to explore the importance of things like understanding the importance of safety, being critically reflexive with an understanding of systems of power and oppression, and ensuring that we're planning to engage, ensuring that when we are planning to engage, we ask ourselves questions like, who's affected differently? Who has different access to the healthcare system? What type of inequities are being faced by people? How are we going to ensure that all of these perspectives are engaged? So I'd really recommend coming to our October session, because we're really going to delve into this new framework and have some good discussion about it. So if I haven't given enough reasons so far on why to engage, let's take a look at some of the reasons why why I think it would be important to engage. So first of all, having people with lived experience help identify research priorities that actually matter most to people living with a health condition, as well as their informal caregivers, families, and communities. So an example of this would be in a rheumatoid arthritis study, researchers felt that the #1 priority for people with lived experience was pain management. And when they engaged patient partners and their families in a research priority setting exercise, what they discovered was it was actually fatigue that was the #1 priority. And so they actually changed their research project based on this. Sometimes we engage people with lived experience to help shape and clarify our research questions so that it actually reflects the needs and concerns of people with lived experience and caregivers. So in a mental health study, people with lived experience crafted the study name and materials to reduce the potential for stigma, and they actually reframed the entire research question with the goal of the study to be a movement towards emotional well-being rather than away from mental health challenges. And so just kind of this way of redoing and reframing the research question towards a strengths-based approach, the input really helped to improve recruitment of study participants and also a greater acceptance of the study by the community in which it was occurring. Sometimes we engage people with lived experience to ensure that research methods that are being proposed for the study are appropriate, are acceptable, and sensitive to the real world context in which people with lived experience live, work, and play. So in a chronic pain study, the initial survey tool was this really lengthy tool, and it was supposed to be administered over the phone. And patient partners, people living with chronic pain, felt that that lengthy phone survey would create a lot of barriers for chronic pain patients. And so they shortened and redesigned the tool to be a self-reported and self-paced survey, and that helped actually facilitate greater ease of participation. But had researchers not engaged people with lived experience, they would have never known that this was a complete barrier with the method, the design of the study. To help ensure that research actually uses outcomes that have true meaning to the lives of patients, caregivers, families, and communities. So in a study on the use of prescription drugs for stroke patients, stroke survivors serving as patient partners on the study identified home time, or the number of days when a patient is living at home, not hospitalized or in another institution, as an important new outcome that they really wanted to have in the study. And this input from patient partners actually was vital in directing the study towards an outcome that they truly cared about. So had they not engaged people, they probably would have overlooked this outcome in their study. Helping ensure that language and content of the information provided to participants in studies, so everything from questionnaires to patient partner pamphlets, are really appropriate and accessible to potential participants. Again, there was a chronic pain study where people with lived experience informed the consent documents, and they were co-developed with patient partners to make it understandable to potential study participants. And this involvement really helped to increase and improve recruitment because people with lived experience actually felt like they were really informed and they felt more comfortable and that their questions had been answered. To help increase participation, I think we've given you a couple of good examples so far in why engaging people with lived experience can really help increase participation in a research study. So because engaging people can help make sure the research is appropriate and acceptable to potential participants, improving the information that's being provided so people can make informed decisions, and also helping to include voices traditionally less heard in research. So really making sure. In a pediatric surgery study, they had engaged parent partners around protocol design. And what they realized was that parents felt more comfortable if the person discussing the risks and benefits of the study and involvement in the study to potential participants was a surgeon. So when that adjustment was made to the protocol, the rates of recruitment actually increased. To conduct data collection. So we've seen this time and time again, having people with lived experience helping to co-facilitate focus groups, interviewing peers is a great way to help put participants more at ease and provide more in-depth discovery as well. When you have people with lived experience helping crafting the development of a focus group and the questions, and then being actively involved in the conducting, it really does create a more depth to the discovery. Interpreting research findings from the perspective of people with lived experience and informing recommendations. So we've seen sometimes with clinical practice guidelines, having people with lived experience being involved in the interpretation and then helping them inform some of the recommendations is really important because it can help improve the lives of patients, caregivers, and communities. Helping to co-develop ways to share and implement research findings with patients, informal caregivers, and communities. So in a large study around chronic pain again, physical therapists partnering in this study designed a continuing education program that was delivered not only as part of the intervention, but also as an important way of disseminating the findings at the end. But patient partners really contributed to the continuing education by providing feedback on what kind of therapy and communication techniques would be more likely or less likely to be effective during an acute pain episode. So they really helped inform that dissemination part. And then to identify a wider set of research topics or new areas of research. We've seen this time and time again where researchers will engage people with lived experience around one area of a research, and partners bring up a whole other area that they hadn't even thought about. We had a clinical trial around septic shock, and patient partners actually brought up frailty as something that was really important to them in understanding more. And so the researcher created a whole other area of research that he hadn't even considered before engaging them. And then, of course, we want to always ensure that research actually reflects the concerns and the interests and the values of the public, and that money and resources are used efficiently. It's really good when people who are taxpayers really know how research is being done and are actively involved in it. Now, levels of engagement, we're only going to touch on this briefly, but we're going to talk about it more throughout the series. But a lot of times in patient and public engagement, engagement is seen as existing on a spectrum, with consultation being kind of the lowest level of engagement. And that's just when you are engaging people with lived experience to obtain their feedback or input about a research decision. but at the same time, researchers still maintain the decision-making power. So that's why it's considered the lowest. I would say if you're ever wanting to really do patient-oriented research or apply to a patient-oriented research grant, you're going to want to be at a collaboration level, or number 3 on that scale that you can see, because it's really about actively partnering with people with lived experience in every aspect of the process. And it's also about shared decision making. So really understanding what participatory approaches you're going to have to use to come to a consensus around research decision making. And then the ultimate, the highest level of engagement is called patient or public directed, but it's also considered community led, user directed. Those are some of the ways in which they're said, which they're called. And that's where people with lived experience or communities are actively control, direct, and manage the research process. And so the role of the researcher is quite different. They're actually kind of there to give advice about the research process, but they may be actively conducting the research, but it's being, all the big decisions are being made by community or people with lived experience, and it's really being directed from start to end by community. And another thing we're going to talk about, and there's a great resource that Trish is going to mention in her piece, is around when we look at the levels of engagement, there are also participatory approaches that we can use depending on the level in which you choose. And so it's really important to kind of think about which level you're at, and then what participatory approach might be good. We have a handbook around that as well. And in our January session, we're actually going to be talking about how to really assess the willingness and expectation, not only of the research team, like what level they're really at, but also talking to people with lived experience about how they would prefer to be engaged. And sometimes that means, depending on engagement of diverse perspectives, you might be using more than one approach, right? And when we move, now that things have moved online because of COVID-19, there's really this importance to talk to people with lived experience one-on-one, and get a better understanding of how they would prefer to engage. So whether it's online or online platforms, but also maybe it's a phone call, maybe it's landlines, and figuring out ways to connect with people and what participatory approaches could be used in this context. And we're going to delve into that lots more throughout this series. But this is just a little bit of a touching briefly on patient and public engagement. And here at CHI, we're always open to more questions and would love to hear from you. I think now I'm going to turn it over to the wonderful Trish Roach.
Great, thanks so much, Carolyn. And thanks everyone for taking a look. I'm gonna direct you to check out the next video where I'll talk about the PrEP award and what makes a strong application for patient and public engagement in funding calls.